is lost because it's a weak tooth, it means that the bone and the gum is actually very good. It really changes how we actually place the implant compared to how we place the implant if there's gum disease. Mm-hmm. So if a patient, let's say, has a tooth problem because of functional forces which are too excessive, we would then ask the patient to consider a functional analysis where we can actually evaluate and assess and diagnose the cause of the excessive forces and then manage those excessive forces either by adjusting the bite so the teeth match together better, or we can give them a protective appliance to prevent them from prematurely being destroyed. So the point is that the absolute understanding of the reason for the tooth loss is really, really critical. Finally, if the tooth is going to be lost because of aesthetic reasons, we might recommend orthodontics to help align the teeth ahead of time, because if you want ideal aesthetics, you need ideal tooth position, and orthodontics is one of the greatest ways to help reposition the person's bite and aesthetics. Sometimes some people will need jaw surgery. There are several things that we need to do to help bring the aesthetics into the right place. Sometimes just putting a nice crown on a tooth isn't going to solve the aesthetic concerns if the tooth isn't in the right position. Mm-hmm. So try to take a broader view of the overall problem rather than just placing a crown or an implant is really important to gain a successful outcome.
I'm just sort of blown away in listening to you talk about that, just how many options there are for treatment and just how far we've come in, as people in our ability to sort of cope with different situations in different ways.
It's so true, Nick. And also we haven't even touched on that other than in the first couple of podcasts, but then there's a whole medical side to it as well. And we talked about that earlier, about the patients who are on medication for depression or for other factors, and they end up with xerostomia or dry mouth. And that plays a huge role in how we try to treat these people. It's a very debilitating condition. And of course, you've got people that have issues with medications that they take for, let's say, osteoporosis, or patients who are diabetics, or patients who are smokers. I mean, there's so many factors that play into the final outcome. So it's not just a technical aspect of dentistry, which is also very important, but you have to combine that with the biological and the medical and the physiological side. And that's what makes it so dynamic and so interesting.
So, Dr. Ickert, are there any closing comments to sort of help put it all together, all of this together?
Yeah, what I'd like to say is that what I try to live by is that no dentistry is better than no dentistry. In other words, the ideal outcome is always achieved with hopefully the least amount of treatment to achieve our desired outcome. And so therefore, it's important that we understand the diagnosis and then move forward in a way that minimizes the amount of treatment required to achieve our objective. But at the same time, we also need to be aware that just hanging on to a highly structurally compromised situation or a highly periodontally involved situation and just trying to hang on until down the road is also not the best strategy, because if you know for sure that the tooth is not going to outlive you, then it might be better to consider removing the cause of the problem early, managing it in a more objective manner, and enjoying the benefits of that result for a longer period of time, never mind the fact that it always gets much more difficult to try to treat these problems as we get older for various reasons. Just getting to the office, finances, healing of the body. It just gets more difficult as we get older. So we really try to help patients understand that if they have a problem that's high risk and it will be a problem long term, then why don't we try to deal with these issues as early as possible? And so the goal is to not give the patient a solution to a problem they don't have. Let's only focus on the areas of risk. And so we can give them restorations and a functioning dentition and an oral environment that is comfortable, that is aesthetically pleasing, and that is long lasting.
Well, we've certainly learned a lot about sort of the importance of these initial examinations. We've been talking about this for 6 podcasts now, and I hope that listeners can see just how important that initial consultation is and how important it is that your dentist sort of take the time to evaluate all potential risk factors and everything. But unfortunately for today, we're out of time. And so if you know someone who might benefit from what we have talked about here today or in the last 5 or 6 episodes, please go ahead and share this podcast with them. I am sure they'll thank you for it. And of course, you can reach Dr. Ickert at www.ickertdentalimplants.com. That's ickertdentalimplants.com. And you can always reach the office by telephone at 604-881-1381 or call them toll free at 1-866-931-1981. Dr. Ickert, as always, thanks so much.
Thank you, Nick. I, as always, enjoy it very much.
Thanks for listening. At Ickert Dental Implant Center, we are committed to providing you with the very best in modern and advanced dentistry. If you would like more information about dental implants and our extensive range of specialized dentistry services, please call us today at 866-981-1381. That's 866-981-1381. Or visit us on our website at www.ickertdentalimplants.com.
Local stories, local voices. We're localwebradio.fm.